Hello and welcome everyone to Ask My Doctor, an exclusive Q&A session sponsored by My American Doctor. I am CB Baby and I'll be your host for today's session. Today we are privileged to welcome a highly skilled expert, Dr. Chitharanjan, an endocrinologist practicing in United States. Doctor, before we dive into the questions, please let us give a bit background of your journey in the field of endocrinology and why you selected to specialize in this area.
Welcome, everybody. Good morning here in the United States and good evening in India and other parts of the world. I am originally from Chennai, South India. I went to med school in Bangalore University. Then I moved over to the United Kingdom. I practiced there for about 12 years. Then I moved over to the United States, again, did my training all over again. I'm a board certified endocrinologist, internist, and also a pediatrician. The reason why I did endocrinology was that it is simply an amazing field, number one. Number two, I had seen diabetes in my grandparents, how they took care of it. If you take care of the diabetes or any endocrine condition, it actually helps prevent complications. My grandfather lived to close to 99 years of age, even though he had diabetes. My grandmother, who had diabetes, followed a strict diet. In that day and age, there was not much technology, but they were so disciplined. And I saw them how they check their blood sugars with the urine. They use the Benedict reagent to check their blood sugars every day. And it is simply amazing how at that day and age, they took care of the diabetes. But now we have so many modern technology and newer medications that would make diabetes management or other endocrine conditions simply interesting, and it is evolving every day. And that's one of the reasons why I specialize in endocrinology.
Yeah. So throughout this session, we will be discussing a variety of important topics from diabetes in children to thyroid health, PCOD in teenagers, hormone imbalances, and more. So stay with us. You should not miss this. We are truly excited to have Doctor here to help us understand these conditions better and answer the questions of our audience. If you're having any questions during the session, feel free to drop them in the comment box below. So let us start with our first question, and it is from Alina. And it is about diabetes. Can diabetes affect children? Is it possible to prevent diabetes? Can it be detected at an earlier stage?
So yes, diabetes, unfortunately, can affect children, even a newborn, unfortunately. And it can affect children at any age or even adults as well. So particularly type 1 diabetes, which is a chronic autoimmune disease that prevents the pancreas from producing insulin. While type 1 diabetes at this day and age, as today I'm talking, cannot be prevented, but it can be postponed through early detection. We have a new medication that is approved in the United States within the last year. It's called as a Tzield or tepalizumab. It's a series of 12-day infusions. If we detect or by screening that these children or adults have antibodies against their pancreas, this infusion can be given to them, and this can actually postpone diabetes. But there are newer studies that show that it actually can be prevented. I have given this infusion to few of my patients, and we've been monitoring them very closely, and we've been able to prevent them from going into full-blown type 1 diabetes. So type 1 diabetes comes in stages. So there's stage 1, where you detect autoimmunity against your pancreas, and stage 2 is when you see the blood sugars going up a little bit higher. If you catch it at that stage, you can actually give this infusion, and that can potentially delay the onset of the full-blown, or we call stage 3 type 1 diabetes. But unfortunately, it is not affordable by everybody. Most insurances here in the United States do approve that, or sometimes the drug company actually does help those patients to get it. But it's really, really amazing. It is one of the pioneering inventions, but there are no more newer medications that are going to be released shortly that will actually cure type 1 diabetes. But at this time, it can only be postponed, but it cannot be prevented. Whereas there is there is another disease called type 2 diabetes, which we commonly see in adults, but certain children, because of lifestyle changes, it can affect children as well, especially younger children, teenagers. But again, with healthy eating, exercise, significantly can reduce the risk of this occurring in children. Yes.
So the new drug that is for type 1 diabetes.
Yes. Yeah, it can be prevented. It is not a cure,
Prevented.
but it's a prevent. It's a prevent. Yes.
Okay. Yeah.
It is not available in India yet, unfortunately. It's available in Europe and here in the United States because of the cost. We are talking about I'm talking about $100,000, unfortunately, the cost of medicine.
Okay.
Yes.
So thank you for shedding light on that, doctor.
Yes.
So now we move on to the next question, and it is from Arjun. So it is regarding the thyroid. Can you please explain regarding the symptoms of hyperthyroidism? What happens when the condition is left untreated, and how this condition is treated?
Very good. So hyperthyroidism, it is characterized by an overactive thyroid, manifests through various symptoms, including rapid heartbeat, weight loss, increased anxiety, being very nervous. Your heart rate can be very fast. A person can have increased bowel movements. They cannot sleep very well. They'll have a lot of weight loss. They'll be cachectic, very anxious. If you see, their eyes will be popping out. It's a condition called Graves' disease. And then this, if untreated, unfortunately, can lead to a condition called thyroid storm, where they have to be admitted to a hospital to be treated. It can cause heart problems. It's a condition called tachycardia or arrhythmias. You can have irregular heartbeats. It can cause bone thinning. The thyroid storm is a life-threatening condition that needed to be, they need to be in the ICU, given various medications. Now, it can be very easily treatable by a medication called propylthiouracil or methimazole or tapazole, we call it. This can be treated as outpatient. We use this medication for a year, and then we see whether it subsides on its own or we call it in remission. If they don't, then we either do surgery to remove the thyroid gland, which is a little bit extreme, or we can do a treatment called radioactive iodine ablation, where it is a simple procedure. They take a pill, and that will kill their thyroid in about 4 to 6 weeks, after which they are on a thyroid hormone replacement therapy for the rest of their life.
That was very informative, doctor. Let's take another question, and it is from Mahesh. So it is regarding the blood glucose levels. Can blood glucose levels be monitored at home? How does this compare to monitoring done in a hospital?
Wonderful. So yeah, blood glucose, as we see the evolution, we used to check blood glucose, as I mentioned earlier, only in the olden times with urine. So, even it's in our ancient scriptures, it says that if you pour urine and if ants come and, they will come to eat the urine because there's too much sugar in it. But now then we had the urine test where we use certain reagents to check blood sugar. But now, since the early 80s and 90s, we've been using a finger stick blood glucose monitoring, where you just poke your finger, put a drop of blood on a blood glucose meter, and it gives you a blood glucose instantaneously using test strips. But unfortunately, it can be expensive because to get a good quality test strips. But now we have technology where we place a sensor on top of the skin and it connects to your mobile phone or a reader. It gives you continuous blood glucose measurements, which can be very easy to monitor. It can prevent a person from, it'll alert if your blood sugar is going too high or too low. So nowadays it's been very easy. They connect to smart pens or insulin pumps. So yes, blood sugars can be monitored continuously like an EKG. How does it differ from blood glucose monitoring in the hospital? So in the hospital, we use venous blood glucose. That means they draw blood from a vein, and then that would be sent to an analyzer. Whereas the blood glucose monitoring that we do at home is capillary blood glucose. So there can be a little bit difference, very minute differences between a capillary blood glucose and venous blood glucose. But again, that is not it does not change our management. So we can use both interchangeably, yes.
Okay. Appreciate the clarity, doctor. So here is the next query that we are having from Rohan. So again, it is related to insulin. So what is insulin pump and which patients need one?
So insulin pump is a small portable computerized device that develops fast acting or rapid acting insulin to people with diabetes, mimicking how the pancreas works. It delivers insulin continuously as a basal rate, and it can also give additional insulin or correctional or bolus doses as needed, usually before a meal or sometimes after a meal to correct high blood glucose. So the insulin pump continuously delivers a small amount of insulin, called as the basal rate, to keep the blood sugars stable between meals and overnight. The benefit of using an insulin pump is that it delivers precise amount of insulin through a pump or through an infusion set, thereby giving only the right amount of insulin that you need. If you take insulin as an injection, you give it as a big bolus. The problem with that is that sometimes you give too much of it, and sometimes it can cause low blood glucoses. Whereas insulin pump uses the continuous glucose monitor, and it talks to it, it interacts with it, it looks at the blood sugar. The program will ascertain how much insulin is going to be needed in the next 1 hour or in the next 24 hours. It uses algorithms. Thereby, it will continuously give insulin. It will prevent a patient from going very high on the blood glucose or very low on the blood glucose. The technology is amazing that now that you don't even have to tell what your blood sugar is. You don't even have to tell what you're eating. You can take a picture of your food on a plate just with your mobile phone, and the computer in the pump will determine how much insulin you actually need. The technology is amazing. It is wonderful to be in the field of diabetology at this time. Yes, an insulin pump can be used both by type 1 diabetes patients and also type 2 diabetes patients, or even during pregnancy now. We use it a lot in pregnancy-induced diabetes, yes.
Doctor, India has become the diabetes capital of the world. And what is your thought on that? And what happened to?
So, yeah, unfortunately, studies have shown that Southern Asian countries have a condition called as insulin resistance. And then people think it is our genetics that we develop insulin resistance. For example, just to give you a brief example, a person who weighs 100 kilograms here in the United States may not develop diabetes. They may just have minimal insulin resistance. But a person in India who weighs 60 kilograms of weight will develop diabetes. It is very surprising as to why this is happening. They think it's because of genetic factors, but you have to understand, in the olden days, for example, to give you an example, my grandfather was not very obese. He was only 65 kilograms in weight, but he developed diabetes. The reason, because in those days, for him to go to the field, to plow the field, he didn't have tractors. He used to sell vegetables when he was very, very young. He used to carry those vegetables on his back, bring it to the home, take it to the market, sell it. But now we have tractors, we have, a modern machinery, we have cars. So we've evolved. But our practices have not evolved. Our food is not evolved. We still eat a lot of rice. We still eat a lot of carbohydrates. And I think that's one of the primary reason. We are not working as hard as we did in the olden days. And I think that is one of the primary reason. But genetic factors do play a role. I'm not denying that. But I think that is a primary reason.
Thank you. So we are having our next question. It is from Sneha. So it is regarding the, again, thyroid. So she's telling, recently I saw a swelling in my neck region. I also experienced pain in the region and hoarseness in my voice, which is not subsiding. Could it be a thyroid cancer?
So a lump or swelling in the throat that does not go away, along with pain, hoarseness, and other symptoms like a persistent sore throat or difficulty swallowing or change in voice, unfortunately could be a sign of head and neck cancer. However, these symptoms can also be caused by less serious conditions like infections or an inflammation. It is crucial to see a doctor or a dentist because it can be a tooth problem as well. But again, if you think about it broadly, head and neck cancers, there are various areas where a person can develop cancer in the mouth, in the throat, in the sinuses, salivary glands. If it is associated with the hoarseness, which is usually laryngeal cancer, it affects the voice box or larynx, which can also cause hoarseness, difficulty in swallowing, a lump or swelling in the throat. But again, they can be swollen lymph nodes. That is again a sign, a different type of cancer. Thyroid cancer can cause a lump in or swelling, but only advanced thyroid cancer can cause hoarseness because it can affect the recurrent laryngeal nerve or the nerve that helps a person speak. But again, even a simple a cause as simple as a sore throat, like for example, a pharyngitis, which can be long-standing, or reflux disease can cause hoarseness. But again, a lump or swelling needs to be looked into because it can be a thyroid cancer also. But again, thyroid cancers are usually not very big, but again, it can develop over a period of time. Sometimes very rare cancers, we call as anaplastic thyroid cancers, that can grow rapidly. Yes, it can be thyroid cancer.
That's an important concern, doctor. Thank you for addressing it. Moving on to the next question, it is from Dave, and his question is regarding the hormone issues. So, do hormonal issues require lifelong treatment? What health conditions are included in this category?
Not all hormone problems require lifelong treatment, and the need for long-term therapy depends on the specific condition or the individual circumstances. Some imbalances might be temporary, resolve with lifestyle changes or medications. For example, if it is diabetes, if a person is on insulin, which is a hormone, if they change their diet, lifestyle, for example, we talked about type 2 diabetes, we can stop insulin. But for example, if we talk about hypothyroidism, unfortunately, that needs a lifelong hormone replacement therapy. There is a condition called Cushing's syndrome or Cushing's disease where we need to take certain medications to reduce the cortisol levels. And then there is other conditions like we're talking about a growth hormone deficiency, where we give growth hormone until the age of 17. And we're talking about sex hormones like where testosterone, we can sometimes give it for up to 50, 60 years, or sometimes even 70 years. Menopausal hormone replacement therapy is used for a few years to manage menopausal symptoms like hot flashes, but some may choose to continue it for a longer period of time, but usually we stop it after the age of 60.
So that definitely clears up the common doubt, doctor.
Right.
So here is another question from Priya. So yeah, it is about Cushing syndrome.
Mm-hmm.
So what she wants to know is Cushing syndrome an hormonal condition? What are the potential causes of Cushing syndrome? And how can a patient get tested for the syndrome?
Very good question. Yeah, it is unfortunately under-recognized. Cushing syndrome is a hormonal disorder specifically caused by prolonged exposure to cortisol levels. This can be various factors, including the body making too much cortisol because of an ACTH overproduction by the pituitary gland, or a CRH production by the hypothalamus, or a body adrenal gland making too much cortisol because of either a tumor which can be benign or sometimes can be cancerous, or another cancer that making to be making too much cortisol, or a person taking too much steroids for different conditions. Like, for example, a patient has asthma, they need a lot of steroids, or if they have certain autoimmune conditions that needs steroid replacement. So excess exposure to cortisol to the body is Cushing syndrome. But again, the symptoms can be from weight gain, especially around the abdomen and face. They'll have thin arms and legs. They can have muscle weakness, fatigue, easy bruising, high blood pressure, high blood sugar. It can be tested by checking a cortisol level, where we do something called as midnight salivary cortisol, or we check a 24-hour urine cortisol, or we do a test called as dexamethasone suppression test, followed by we do scans of the adrenal gland or the pituitary gland, or, for example, if it is a smoker or if it is certain cancers that producing cortisol, then we need to further investigate by doing whole body scans. But again, they are very rare, but they can happen as well. Yes. And it can be treated very easily. I mean, it's unfortunately, you need to see a specialist for this. There are newer medications that we can use to treat them, or to remove the cause of that excess cortisol, which is usually by doing surgery on the adrenal gland or the pituitary gland.
Okay. So thank you for that insight, doctor. So let's continue to the next question, and it is from Kabir. So he's having some doubt on brittle bone. So why do bones become brittle after an age, after a certain age? How to prevent this condition?
Yeah, brittle bone disease, or we simply call it as osteoporosis. It causes bones do form and break and form and break continuously. The bones have certain cells called as osteoblasts and osteoclasts, which form bone and which reform bone. Osteoporosis is a condition where there is too much osteoclastic activity, whereby bones do lose their tensile strength and they do become brittle after a certain age, because usually because of hormonal factors. There is a crucial hormone called estrogen, which is very much needed for the bone. When a person undergoes menopause, especially in women or even in men, called as andropause, that causes the bones to become weaker. But there are other genetic factors also play a role in osteoporosis, whereby, for example, if a person's mother or father develop osteoporosis at a younger age, their siblings, or their children also can develop osteoporosis early. So by doing aerobic exercise or weight-bearing exercises, bones can continuously become stronger, and taking vitamin D and calcium supplementation also can prevent or osteoporosis, or help cure osteoporosis. There are certain medications that we use now. We have denosumab, we have bisphosphonates, and there are several newer medications that can be used to treat osteoporosis.
Thank you, doctor, for the clear explanation. So we are having another question from Arya, and it is about obesity. So what he wants to know is, what are the causes of obesity? Is it caused by overeating? And how can we manage obesity?
So obesity is caused by a combination of factors. It's a multifactorial disease, unfortunately. It includes genetics, that is, if your forefathers were overweight, and unfortunately, it can be passed on generations, unhealthy eating habits, lack of physical activity, environmental factors. Managing obesity involves a multi-pronged approach that includes dietary changes, increasing physical activity, and in some cases, medications or surgery. The body, unfortunately, has a set point whereby even if you lose weight by taking medications or by doing surgery, increasing physical activity, if you relax after a certain period of time, the body goes back to its original weight, and nobody knows why this happens. So it is going to be a lifelong, um, um, what do you say, lifestyle change, which is very much necessary for managing obesity. It is not only by overeating, but it can be due to overeating as well. But again, lack of physical activity, environmental factors, sleep deprivation, stress, certain medications, certain medical conditions can cause obesity. But now we have various treatments, including medications, bariatric surgery, seek a professional dietitian who can help address some of your eating habits that can help treat obesity.
Okay, it's such a relevant topic nowadays in today's world. So
Unfortunately,
let us move on to the final.
yes.
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 So let us move on to the final question. So it is from Rekha, and it is about PCOD. So what she want to know is, what are the common symptoms of PCOD? Can PCOD affect teenagers, or is it only seen in adults? And you want to know, what are the treatment options available?
Wonderful. So polycystic ovarian syndrome or polycystic ovarian disease, it can affect teens and adults. Common symptoms include irregular periods, excessive hair growth, acne, and weight gain. Again, in the past, we thought that polycystic ovarian disease patients always usually are overweight, but that is not true. Even people who are leaner can develop polycystic ovarian disease. These are usually due to excess male hormones, irregular periods, or very light periods. It can lead to irregular ovulation or sometimes even infertility. Excess hair growth, again, caused by androgens, hair growth in areas like face, chest, back, and abdomen. Acne it can worsen or it can trigger it, particularly on the face, chest, and back. Weight gain is also associated with, especially around the abdomen, as we discussed before. But hair thinning can be seen on the head, patches of dark, thickened skin on the neck or armpits, suggestive of insulin resistance. We can have skin tags. Polycystic ovarian disease symptoms can become, unfortunately, troublesome for some of the teenagers. Even in earlier cases, sometimes may need to start, we call it as birth control pills, or to regulate their menstrual cycles. But unfortunately, there is no certain set treatment for polycystic ovarian disease, but we individually assess each symptom. Like, again, there is a medication called spironolactone that we prescribe for people who have problems with excessive hair growth. If it is because of, if they are having trouble with weight gain, we give them the newer medications like GLP-1 analogs. We call this the semaglutide or liraglutide or tirzepatide to help them with weight loss. It is important to note that people with polycystic ovarian disease do develop diabetes in the future. It is very, very crucial to address it at the earlier stages. They can also develop heart disease. They can also develop a condition called as obstructive sleep apnea. So it is very, very important to address it at the earlier stages and start treatment early, seek a specialist help.
Thank you, doctor, for shedding light on that. So it seems it is not only affecting the ovary, it is having multiple symptoms, and multiple parts of the body is affected by that.
Yes, it's a multi-system disease. It's not very well recognized. We are learning more and more about it, those conditions. Like I said, there is not a particular treatment because it's a syndrome. There is no one test that can diagnose polycystic ovarian disease. It can be difficult to diagnose, and there are a lot of stigma around the disease, but it is treatable with certain small changes that what we just described.
Okay. Doctor, when it comes to conditions like diabetes, thyroid disorders, PCOD, hormone imbalances, why is getting a second opinion important? Could you help us understand when and why someone should consider it?
Yeah, second opinion. See, I'm not finding fault with one physician or the other. Second opinion is always important when you feel that something is not really right, something is not really working, or if you feel that you think that you need to get a second opinion, or if you feel that, for example, the explanation what a previous physician has given you does not satisfy your belief of what's going on, or it's always important to get a second opinion because not every physician knows everything. There may be certain things that another physician knows than you do, another physician. Or, for example, getting a second opinion from a physician who is abroad, there may be certain newer research that is available here, or newer treatments that are available here that is not available elsewhere. And then also, one specialist will know more about a particular disease than another specialist does. So, and I think it's crucial to get second opinion always, to have another physician give his or recommendations, or what we simply used to call, when I was practicing in the United Kingdom, we used to call it as a multidisciplinary approach of treating a condition, and I think that's crucial. But we call it a second opinion. But when you involve multiple specialists in treating a condition, then you address everything. For example, if I'm seeing a patient with diabetes, I involve a dietitian, I involve a social worker, because it is not just because of diabetes that, because of their habits. It could be because they're not able to offer their medications. It could be because they're having, for example, depression that is not treated. I have to consult a psychiatrist. So it's always important to get a multidisciplinary approach on a particular disease, and we call it now here second opinion. But a second opinion is also important, I feel.
No. So if you're seeking a second opinion or would like to schedule an appointment, please call or WhatsApp us at 919914941494. So this brings us to the end of today's live session. A big thank you to Dr. Chitharanjan for sharing such valuable insights and answering all our questions with such clarity and expertise. And to all our viewers, thank you for joining us. We hope you found this session informative and helpful. Before we go further, please comment on and let us know what medical specialty would you like to feature in our next live session. Thanks again, stay healthy, and we will see you next time.
Thank you.
Thank you, Doctor. Yeah. So, Apurva?